here at the University of Oklahoma for our monthly webinar series. I am Dr. Jenny Rungu. I'm the Executive Director of the Southwest Center and the Director of NCORE, and I'm very delighted to be your host today. For those of you joining us for the first time, NCORE offers 2 webinars every month, one on the first and the last Wednesday of each month. In October, however, we do have 3 webinars after rescheduling one from last month. Our Emerging Scholars webinars are held on the first Wednesday, and they focus on ideas that speak directly to the experiences of students. These webinars are either facilitated or co-facilitated by a student and are intended to identify emerging scholars, and these are always available at no cost. Our next student webinar will be presented on October 7th by doctoral candidate Jennifer Batchelder from Florida State University. And Jennifer is going to explore a different approach to developing leadership in the Latinx student population. Our season scholar webinars will be held on October 14th, everything involved in what we call online learning. And on October 28th, we shall have race, class, gender, and media, teaching diversity, equity, and inclusion in media and communication studies. Please visit our website, www.ncore.ou.edu, for the full list of featured webinars for this season. We ask our attendees to use the chat box to tell us where they are watching us or joining us from. Also tweet, Instagram, Facebook with the hashtag NCORE, start the conversation online. It is incredibly important for us to stay connected, especially during these uncertain times. Closed captioning and ASL is available for this broadcast. We thank the Sorensen colleagues for providing that. Today we have Dr. Kriya Valderrama Wallace from California State University, East Bay. Her topic is reckoning with the racism and colonialism of nursing education to move towards health equity and healing. The center is very grateful for her expertise. Remember to post your questions in the Q&A box and she will address them at the end of the presentation. Welcome, Dr. Valderrama.
Thank you so much, Dr. Irungu. Greetings, everyone, from whatever time zone you're coming in from. I'm humbled and it's an honor to be invited by the NCORE community to speak with you all. So I want to make sure that we as a community embody the values of NCORE. It's really vital to our community that we are very explicit that this is an inclusive environment free from all forms of discrimination, harassment, and retaliation. And we know that's also vital across these digital platforms. So I want to lift this up. I also want to acknowledge that I live in Huichin on the original unceded ancestral homelands of Ohlone peoples in what's commonly known as the San Francisco Bay Area. I pay respect to all Ohlone peoples, past, present, and future, and I am proud to be a part of an Indigenous Acknowledgement Collective at my institution, where we are seeking to state whose lands we are on, but also embody that in our lived experiences and in our institutional decisions. I'd like to first start with gratitude for all the truth tellers, the scholars, the comrades, the kansamas, my ancestors, without whom I would not be here today. And this is just a quick snapshot of all those who I express gratitude for. I'm so delighted that folks are including in the chat where you're from. I also invite you, if you are so moved, to go ahead and follow this link that I'm going to drop in the chat. You are welcome to add your location there as well, and you can even add, what division or department are you hailing from, what discipline? I know the title is focused on nursing, but there are so many health professions, education, avenues out there, so I welcome you to share. So when you click on that link, you'll see this map, and all you have to do is click on that pink circle, type in the city where you live in settler colonial terms, the city you live in and the city you're zooming in from. And then go ahead and add, where you're from, what you're seeking to learn from today, what questions you have for me and for each other. And you're welcome to edit this throughout the presentation so that we can build community. Now, to be clear, I want to start with my own positionality, who I am a little bit and where I come from, because that shapes everything that I do. It shapes the questions I ask. And so I am a daughter of the living colonial legacy of the US and the Philippines. And so I have a particularly strong commitment to an anti-colonial lens and stance. My education has taken me through many different avenues, from physiology to Italian, to public health, to nursing, and informally through mentors, sociology, and education. And in terms of my own exploration as my Filipina self and history and struggles of my peoples, that has rarely taken place in a classroom. That has been in community aside of formal institutions. And I will forever be grateful. Also within my own positionality, for me, health equity and healing must be lived. It does not exist in silence or nor in silencing. And so I would say, as nurses, as healthcare professionals, if we are not actively working towards social justice or health equity or anti-oppression, then we are contributing to it. So that's a little bit about myself and where I come from. Now I want to lift up this quote by Audre Lorde. The fact that we're here and that I speak these words is an attempt to break the silence and bridge some of those differences between us. For it is not difference which immobilizes us, but silence. And there are so many silences to be broken. So I invite you, even in that Padlet, or just in your notes, or in your mind, or in your heart, what are the silences in health professions that maybe brought you here today to this session? What are the silences that now help you and shape how you navigate learning settings? Now, something that's interesting is when you Google nurses, this is what you see. I Googled this last week. I Google this every year in different ways for different presentations, and it is the same. We see scrubs, we see hospitals, we see smiles, we see primarily white folks, we see stethoscopes, we see hallways that are sterile. And so if you are a nurse or identify as a nurse or a nursing student, as a dean, as faculty, how does this jive with the future of nursing that we are seeking to embody and envision? And when we think of nurses, when we applied to nursing school, when we think of nurses who we present as leaders in our learning settings, are any of these amazing nurses included? Nurses who go, on strike with teachers, a representative Lauren Underwood, who is such a leader and is bringing along nurses with her. Do we think of Diné midwives? Do we think of union leaders? Do we think of nurses who are on the street putting their lives on the line in different ways? So I invite us to consider, who are the nurses we uplift? Who are the nurses that we share with our students as that can be your future in nursing, or a version of that? And it's not lost on us that, it's 2020. This is designated as the year of the nurse and midwife. So how are we living that out in our programs, in our many roles? Are we on editorial boards? Are we scholars? Are we working with grassroots organizations, right? So what is the future of nursing that we have inherited? And then what is our responsibility to the communities we serve? We also have the ongoing Future of Nursing report, which is delayed so that they can take into account COVID. So this will be published in spring. So now what is the future we are leaving through our own action and inaction across all of our institutions of nursing? And how do we ask each other and our students to think about these questions as fundamental to being in nursing? Right, so I'm going to shift the focus a little bit to some of the roots of our profession. Now we have colonialism, many definitions, but I do want to focus in on the fact that at the core is military, at the core is economics, as well as cultural oppression and domination. At the heart of colonialism is dividing the whole into pieces to claim expertise and ownership. We see that in our curricula. We see a focus on particular organ systems. We divide across age groups. We separate maternity from pediatrics. We separate acute from community as though those are separate. So I invite us to think about how we claim expertise and ownership and how that shapes us as a profession. I also want us to be clear that there are various dimensions to racism. We have internalized racism, there's interpersonal racism, institutional as well as structural. And I just want to lay this out clearly. I know this is an NCORE community. There's a level of fluency here. But I think it's very clear when we look at our nursing institutions, you can succeed to become a dean, you can become a chief nursing officer, you can become faculty, you can get top honors as a nursing student and never have to have a level of rigorous understanding of these. So I want to be clear about these here. As well, we have neoliberalism, the sense that, you know what, free market capitalism, it'll all work itself out. No one's going to buy a product if it's harmful, right? We see that with education, we see that with housing, with healthcare. Maybe somewhere near you are nurses who are going on strike and various healthcare workers who are going on strike. So I want to ground us in these roots of society as well as our nursing profession. Now, I'm not going to go through the whole history of medicine and healthcare and nursing, but I do want us to situate ourselves within these centuries and millennia of history and ideas about who healers are and what healing is, right? So we have here ancient and pre-colonial systems. What are views of health that are ancient, that aren't rooted in maybe Greek mythology, right? And then how do we fast forward and say medical and military work together to shape professions and to shape colonization? So, you know, I said earlier in part of my positionality as a Filipino woman, I really have to dig deep and look at what is the role of colonialism? What are these ideas of hygiene? What are these ideas of discovery, of medicine, of health that have shaped who becomes a healer, who becomes a nurse, and the content that we teach? So we see here images of comics from newspaper clippings from the turn of the century. We see here on the top right, there's a comic of McKinley holding a Filipino, and the comic is called The Filipino's First Bath. We see handing out of soap to indigenous peoples in the caricature in the comic on the bottom left, right? So when we say colonialism, I want us to be clear that extracting raw materials, gold, platinum, et cetera, went hand in hand with extracting scientific information and also specimens that continues today. So they're very racialized notions of morality, cleanliness, as well as disease. That's also layered with gendered notions. And we also see that soldiers who carried out genocide of indigenous peoples here in Turtle Island or North America participated in colonization abroad. And now when we zoom in and anchor and look at the role of professional nursing organizations, we see that the founders of the American Nurses Association were actually instrumental in establishing nursing in the Philippines as gendered, as well as labor or export oriented, so that there's a direct line for nurses during the time of shortages. And I also can't talk about this without looking at the particular impact of COVID on Filipino health workers, especially after we just speak about colonialism. So if you haven't already, take a look at this website, kanlungan.com. Kanlungan means a harbor or sanctuary. And this report was just released yesterday. Filipinos, we make up 4% of nurses in the US, but just over 1/3 of nurse deaths from COVID. So I ask us to consider that. These are living histories. And I invite you all to consider, how do you question what you're taught and what you're teaching? What do we know about human anatomy? How do we tie that through to segregation of all aspects of life, including where folks are buried, segregation of cemeteries? The most esteemed medical schools in this country routinely grave robbed. And so, the focus on proving through scientific means that particular groups are biologically inferior, that's at the root of our profession, of health sciences. And if you haven't already, I really encourage you to read Medical Apartheid by Harriet Washington. I want us to take a moment as well to uplift the names, Lucy, Annika, and Betsy. Oftentimes when we look into our history, who are we uplifting? Who are we lauding as heroes? And one of those is Dr. J. Marion Sims, often called the father of modern obstetrics and gynecology. But really, he purchased enslaved women, Lucy, Annika, and Betsy, and practiced and performed so many procedures on them to practice procedures and to develop them. And those are procedures used today. So I want us to consider what were we taught and what are we teaching? How have we come to know what we know? I also want us to see this in terms of intersectional areas of dynamics of power, you know, even looking at sexuality as well. So the term heterosexual was first printed in a journal, in a medical journal in Europe in 1892. And we also see how ableism, you know, the tragedy model, oh, you know, the religious model, you have a disability because you or a parent or an ancestor sinned. That's why you have a disability. And we see these framings today in textbooks. We see them in our admissions criteria as well. So I want to touch a little bit briefly on how these roots play out in practice, in education, in research, in policy, and briefly in our professional organizations. So let's start with practice. We see here, you know, even as the news of Don Wooten, a nurse whistleblower in Georgia, shared with the world that, you know, ongoing forced sterilizations is an issue and that it collides with our immigration policies. So this is a poster from the 1970s in San Francisco of an action. We see that well-known athletes who know their bodies so well are not believed, including by nurses. We also see the popularity in social media of nurses who are okay teasing patients, saying, we don't have to believe you, and turning it into a joke. And then we see findings like this, where it goes beyond racial concordance to structural racism at all levels. So I ask you, where do we talk about health literacy? How do you go from racist practice and structural racism to blaming poor health on health literacy? You know, what is the relationship between hospitals and police? So there are many layers here for us to consider. Now, looking at these roots in education, so this is a snapshot of a table from the California BRN report from 2018 to 2019. So I ask you, what are the attrition rates in your area? What do they tell you about how we are supporting or allowing or gatekeeping, right? So here in California, the highest attrition rate, 15.8%, was among African-American nursing students in BSN programs, followed by Asian at large, Filipino, and Hispanic. So again, I ask you to take a look at attrition rates, both at your institution and in your state. What does that tell us? What does that tell us about what we need to do and what other questions we need to ask? So looking at the demographics of nurses in California, again, I'm in Huichin in the Bay Area, so I'm rooting my data in this, but I ask you, what are the historical trends and ongoing legacies of workforce demographics in your area? So in California, we have on the bottom here, in the bottom left, 14% of our state population is Asian, 38% white, and so on and so forth. If you look at our LVN population, it's very different, right? It's much more diverse racially. Now here on the right, we see the race and an ethnic breakdown from 2015 among employed RNs. It's very different, right? And then on the bottom right, we see newly enrolled students. So what are the policies and practices that have shaped who becomes an RN, who becomes an LVN, who applies and gets, you know, accepted into our BSN programs and our LVN programs, right? So I want us to see that these are more than just data points, but they shape how we advance nursing, how we define nursing. Okay, a little bit more on education. Now, how do you, in your various roles, in your committees, maybe when you do your own scholarship, in your classrooms, how do you talk about culture? Similar to racism, it's perfectly fine in nursing to not have a really rigorous understanding or pedagogical approach to culture. Oftentimes in nursing, culture is conflated with race. And so we go from this type of model, which is more nuanced, to pages like this in a textbook. So this is from a transcultural nursing textbook published 3 years ago. We end up taking groups and making them into monoliths. By we, I mean nurses, but really it concerns me that tables like this exist at all, where entire groups are reduced into these quick bites of here. For Chinese Americans, if you're taking care of someone who's Chinese American, you know, be careful about excessive eye contact or excessive touch, avoid eye contact, of all the things we could be talking about. So how might we change our approach to looking at culture in nursing education. So it's not rooted in anyone who's not Christian, not white, not cisgender, right? Now, moving forward to research. How do our roots of racism, neoliberalism, and colonialism shape our research? Here on the left, it says here, the topic choice contributes to the lower rate of NIH awards to African-American Black scientists. So we actually find here that Black scientists are more likely to study population health, health equity, right? So there's a relationship between who is entering our field and the research questions that we have in our epistemologies. We still and now we go to the trends in health disparities. So again, what are we studying? So this team here on the right took a look at, what are we studying health disparities? Are we studying health equity? Are we studying social determinants of health? There are thousands more projects. The funding for health disparities research is 15 to 19 times greater than the other topics. So we're doing a great job at just trying to describe, but again, a disparity does not root it into the cause, which is, and health disparity is just, there's just a difference. But health inequity means that that difference is rooted in unfairness and is preventable. And I want to shout out colleagues, Dr. Monica McLemore, Lucy called her a colleague. She's really just someone I look up to. But they published a new standard for publishing on racial health inequities. So if you haven't seen that article yet in Health Affairs blog, I encourage you to take a look. Now let's shift over to policy. How do racism, neoliberalism, and colonialism influence nursing policy? So if we look at maps like this is our BART map. It tells us life expectancy at birth, tells us median household income, share of adults with a bachelor's degree or higher, as well as childhood asthma hospitalizations. Now, what are the thousands of policies and decisions made at so many levels that allows this to happen, that normalizes this, and maybe even guarantees it, right? So how do we situate ourselves within nursing in relation to findings like this? Now, the Robert Wood Johnson Foundation has put out really wonderful maps. So there are maps from Minneapolis, Kansas City, Central Valley in California, Chicago, et cetera. So I encourage you, if you're not already looking at graphics like this that demand that we work in interdisciplinary ways and ask questions that are rooted in primary prevention, to please, consider these resources. Now, looking at policy, the ANA just released the 4th edition, the draft of Scope and Standards of Practice. So I encourage you to take a look at that draft. We also see that just in 2019, the ANA adopted a new presidential election policy. And this policy basically says, we're not going to endorse any presidential candidate. And in these times, with the poor leadership that we've had for the National Nursing Association organization to not endorse a candidate, it tells us all we need to know. We see that nurses are standing up, going on strike. We also see that there is a slashing of benefits for healthcare providers, and we see the need for ongoing whistleblowing. Now, looking a little bit more closely at the ANA as one example of our professional organizations, social justice is only really mentioned in our Code of Ethics. It barely is present in the other 2 documents. Now, again, these are the documents that tell us who we are, what we do. Now, this is the definition of social justice in our Code of Ethics. It basically tells us that it is our responsibility to address unjust social systems. So how are we doing all of this in our many roles as nurses? Is this a through line? Is this clear to our students and to our colleagues that this is something we're committed to? Okay, so now switching gears a little bit to mapping. I'd like us to map, to think about reckoning, to think about reflection, strategic action, and accountability. So I'm going to be sharing a little bit of a framework here, but also asking you to consider where you are in your role. What are the many ways that we need to come together and really work towards a future of nursing where nursing is an act of social justice. So thinking about the many roles you have, the committees you sit on, the projects you say yes to, the projects you say no to, the learning materials, etc. So let's start at regulation and accreditation. So in our present regulatory landscape, who is protected? Who is actually benefiting from these regulations and accreditation standards? How are we defining safety? What is the role of the NCLEX? What is the role of our essentials documents? How are we weaponizing professionalism as a role of gatekeeping and upholding white supremacy in nursing? Now, looking beyond the institution, who are we in relationship with beyond our departments and programs? How do we actively address the power dynamics so that we don't fall into voyeurism, for example? Who are members on our advisory boards? Are they all doctorally prepared nurses? Do we have community members who we often label just as patient? What are the pipelines that we're forming with community groups, grassroots organizations, youth groups, high schools, elementary schools? Where are community voices in your programs? Who are we answerable to? And does that become something that students think of routinely in everything that they do and everything we do as faculty? Who are we answerable to? And finally, whose solutions are centered? Now, looking at our program policies and practices. When was the last time you did maybe a critical race theory focused examination of your admissions policies, progression policies, hiring, right? Again, if we did a CRT focus analysis of our handbooks, our student handbooks, maybe about appearance, about hair, about clothing, and also our faculty handbooks. How do you approach advising? Do we approach advising as focused primarily on logistics? Or is it also inviting students to be whole, their whole selves in a meeting, right? Do we focus on logistics and delivering a curriculum? Are we also fostering a sense of community, of wellness versus just delivering and making sure people graduate? Where do we foster a sense of how to facilitate dialogue? And what do we celebrate? Do we have a strength-based approach to students? Or at every turn, are we wondering, how are they going to cheat? How can we prevent that? Right? When we have overlapping faculty roles, how do we protect students? So if a student has a concern about a faculty member whose course they're taking, but that faculty member is also their advisor, what options do we give students to be able to have agency and take leadership? What are our priorities in our departments, in our programs? Right? How are we advancing the profession? How are we situating our individual departments within the broad scope of nursing a society, as Dr. Monica McLemore was saying, nursing the nation? Are there BIPOC students and faculty who are just surviving us in a meeting, surviving course evals, right? What are the power dynamics between staff, students, and faculty? If you were to spend an hour with staff, perhaps in a cubicle setting or having a meal, what might you observe that you might not observe if you're only in your office or only in a learning setting? And what does that tell us about our communities? Okay, now looking at curriculum, when you look at your roadmap, your curricular roadmap, what does that tell us? What are the priorities? What are the specialties? What are the names of your courses? Why are we still calling it maternity, right? What are the silos? And at what point in your curriculum do you ask students to put it all together versus dividing by age group, versus dividing by mental health, infectious disease, chronic disease, right? How do we invite and ask students to really connect the dots across our curriculum? And maybe should we even be positioning them in that way? Should we be challenging our own curricula so that we don't separate human bodies and communities as a norm? Okay, what are the threads? Do you have a thread related to Nutrition, that's a common one. Do you have a thread where you look across your curriculum and look at, you know, Kaplan or another, you know, way to support NCLEX success? Do you have ethics? So what is the role of a curriculum committee? How are we in our programs protecting the hidden curriculum? Right, the hidden curriculum where we protect particular ways of thinking, narrow ways of viewing health, right? And what are our contradictions? Might a student be learning, if we just get people to eat better and make better decisions, they'll be healthy? And in another course, we ask students to really take a look at our food ecosystems and to look at trade policies and how that affects rates of obesity, right? How do we ask students and how do we ask ourselves what the contradictions are in our programs? What do we consider the fundamentals of nursing and what do we leave to the side? Is it pathophysiology? Is it pharmacology? Is it how a particular organ system functions? Is it a more nuanced, you know, understanding or notion of culture? Do we expand how we define safety to include an awareness of trauma and a focusing on healing? Do we bring in current events and current issues into our curriculum? Is that an expectation? Right? When we think about our SimLab, simulation scenarios, what are the topics that we're bringing into our scenarios and what are we leaving out? And what does that communicate to learners? Do we focus in on quote unquote vulnerable populations without saying, well, maybe why they're vulnerable? It's a nice euphemism, right? So I want us to consider all these layers of curriculum. There are more, but this is just to get us, you know, started. Now, if we look at pedagogy, now there's so much here. Where do we bring in counter narratives, right? So if we're talking about obesity and we're looking at it in such a medicalized way where we focus on BMI and you need to eat this, this, and this, and not this, that, and that, right? So for example, in one of my classes where I teach, you know, I teach community health nursing, I teach epidemiology, I also teach community engagement. But in one semester I taught nursing research and evidence-based practice. And I brought Roxane Gay's book, Hunger. And I read aloud from it, I asked students as well. And I thought, now, how does this elevate our conversation about quote unquote obesity as a health crisis? What else is going on? Right, so whose voices are we bringing into our classrooms, into students? You know, the compass by which they define and pursue nursing. What are the learning materials we're bringing in? Are they all written by nurses? Are they all written only by nurses of a particular specialty? Are they all peer-reviewed research and are they all textbooks, right? Do we ever bring in music and poetry and art? Do we bring in emotions and wholeness? Do we ask students and provide a space for students to come in as authentic and whole as they can or need to in that moment? Or do we push through because this is what we're going to be testing on soon, right? So how do we create that space? How do you identify and know that power dynamics are always at play? You can say, come to my office hours at all times, just, I'm here. This is my office, please email me. Or if you have a question, please contact me. You know, there's a little bit more that's needed to really cultivate relationships so that students will actually see us as partners. Okay, when we put together our case studies, are we narrowing it so that, oh, we want to talk about HIV, so let's make sure the patient is queer? Are we talking about a Latina patient and, oh, she just happens to be a single parent working 2 jobs with 4 children? Are we challenging stereotypes or are we perpetuating them? What are the scenarios we're bringing into SIM? Do we provide students a space to stumble and to learn in public with humility around issues related to power dynamics or racism or transphobia? Right? Are our assignments opportunities for students to engage in real-time advocacy? Right, so right now, for example, I mentioned earlier, the Future of Nursing report, that task force is doing the work, they're collecting data. So in my community health nursing course, I asked students to examine a particular topic, what are grassroots orgs saying about it, doing about it, What is nursing doing about it? And then they would turn that in, and that would be their assignment. And they would turn it into that task force. So how are we engaging students in a way where they know their voice is real time and it's advocacy? In my community health clinical course, each student every semester has to do 2 public comments. It can be at the, maybe the air district quality board. It could be the school board meeting, a city council meeting, you name it, they can go there and they can present their argument. And it gives them practice, putting together all the skills of what we say nurses should have and should be. And so how do we build an advocacy? Do we maintain a quote unquote apolitical stance? Do we center in diversity in aesthetic ways? Okay, so in one of my studies, I interviewed nursing educators across California, and there are several who, when I asked them, how do you teach social justice? One of the first answers was, I make sure in my PowerPoint slides that I have nurses who are Black, nurses who are Muslim, nurses who are Asian, and patients as well. And so does our diversity go past aesthetic diversity? Superficial, right? Now we think about our pedagogy. In what ways might we actually be asking students to blame people for being sick or for being poor? So in what ways do we pull that gaze from vulnerable population and blame to the context, which opens up the doors to all these avenues for change across levels of prevention? And then finally, what skills do you assert as fundamental to nursing? What can be changed? What can be added? You know, when I asked students, and you know, I told them that public comments were going to be, you know, the key to success in the course, there was such terror. And so we worked through that. We practiced together. There are times when I give a public comment first so that students know I won't ask them to do something I wouldn't do myself. That BART map that showed the life expectancy and other data points, I show them that and I say, what is the role of nurses in addressing this, in addressing these inhumane health inequities? And sometimes there's well, can we put together a blood pressure clinic? Can we make sure everyone has insurance, has access to healthcare? Absolutely. And what else? Right? What else is needed? And it's that cliff of, oh, did I go to nursing school for this? Is this what a nurse is? So I asked you to consider, again, one of those first slides I shared of nurses when I Googled it. Nurses who are just in scrubs in a hospital, is that all that nursing is or can be? And also nursing practice within a hospital setting. I'm sure there are so many layers that can be addressed so that we can practice to the full extent of what our patients deserve. So I asked you to consider, what are the questions that you ask students to ask? What are the questions that are core to our assessment? So oftentimes we say, how do we reduce health disparities? And so now in my community health nursing course, I'm asking students to, instead of looking at how to reduce health disparities, I ask them, well, how do we eliminate social injustices that actually produce health inequities? I ask students, who is best positioned to define a problem? Is it just the CDC? Is it just the Department of Public Health? Right? So who are the residents that you can speak to who really know, right? The community residents who really know what's happening. So I ask students, and this is their primary assignment for community health nursing. We don't ask the typical, what are the subjective and objective, what are the problems, how can we solve them? I really want them to come to this assignment from a more nuanced perspective that decenters the biomedical model. And then this is the framework that I use in all of my courses. So this is the Bay Area Regional Health Inequities Initiatives Framework, the BARHI framework. And this is really called together by several epidemiologists in the Bay Area. And I asked students at the very beginning of the program in semester 1, where do you see nursing? And oftentimes they will see it right at the end on the right, most downstream, preventing mortality, and then treating, medicating disease and injury, and then maybe touching base on risk behaviors if we see ourselves having the time to do that teaching, or maybe we see ourselves in non-acute care settings. And gradually over the course of the curriculum and over the course of the 5 semesters, we have them looking at living conditions, We have them looking at, where are the railroads, where are the highways, which neighborhoods were demolished to build the highways here in the Bay Area. What is the role of the 5 oil refineries in the Bay Area and the different sequelae and different types of respiratory issues and other issues related to chronic disease that our community members are grappling with, right? So we start looking at all the complex bits rather than reducing and seeking to own and seeking to establish ownership and expertise. We open up their eyes. And just today in class, a student said, when I thought about domestic workers and the fact that they have been shut out of labor protections, my grandmother's a domestic worker, and I didn't even think about that until I started doing a little bit of research. So how do we ask students to situate their own lives and the lives of their communities within a framework like this, so that nursing isn't just something that we step into, but nursing is who we are and what we do? And then we start looking way upstream to institutional inequities and social inequities. So this is a wonderful resource I have come to use and rely on greatly. Now, in terms of resources for us to consider, something I do want to name explicitly is the fact that any learning I have done in relation to anti-colonial theory, critical race theory, queer theory, disability justice, none of them were assigned to me by nurses. And so what are we losing when we maybe narrow the canon of nursing education? When I say, who are the voices we're bringing into our classrooms, I think of these covers, and these are just some of the many, some of the many scholars and activists and thinkers and truth tellers. I want to point out briefly the color of law. So in one of my courses, we really review over 300 years of racist and xenophobic housing policies. And without fail, there's always a student who is thinking, you know what? And they'll email me or they'll put it in the course eval. They will say, why did we spend a whole seminar on housing policies? Why couldn't you just teach us how to treat someone who's homeless? And that is a cliff that I think we need to address in nursing, is who are nurses and what is our purview? If people matter most to us in our profession when they are sick and suffering, what does that say about our profession, right? And so when we consider all these different voices here, when we think about the fact that Children's Hospital in Oakland turned away Black families. And so what the Black Panther Party did? They set up testing sites, so how are communities navigating survival and seeking to actually embody joy and to dream, not just be in survival mode, in spite of our institutions? How can we be a part of that? Right, so I invite us to consider all these different voices. Where are you learning about health equity? How are you learning about social justice? What are the disciplines that we maybe silo ourselves off from? Is it psychology? Is it sociology? Is it ethnic studies, gender studies, geography? We can look at the role of borders on health. What is our role as, if you don't identify as Indigenous, and I don't, what is my role as a settler? I am contributing to ongoing displacement. So again, what is the role of nursing in all of these roles that we have in our committees, in our classes, when we're putting together our syllabi, when we're establishing committee priorities for the academic year, when we're reviewing admissions policies? So there's so many things for us to consider. And how are we bringing in art? Might we ever consider a walk through maybe an area with a lot of street murals as fundamental also to understanding the health of a community and the voices who matter? So I put more resources on the right. There's the American Public Health Association's Racial Equity Webinar Series. They have been such leaders and have been for years. And so oftentimes what happens is because of that bifurcation of acute care versus community, we end up separating from each other and not seeing that we all have a role to play in relation to public health, that it's not just community health nursing. Right? So this is challenging the silos that we uphold. There's also this really amazing syllabus, A History of Anti-Black Racism in Medicine. I encourage you to take a look at that and delve into it. Turn that into a ongoing strategizing sessions and reflection with your colleagues. Something I do want to add about that, because I just said reflection is, there is so much scholarship around these topics. If we stop at just reflecting at how we feel and what we think about racism, are we actually going to dismantle it? So I always invite us to consider praxis, right, from the reflection to action. There's also Nursing Mutual Aid, an amazing group of nurses who are, you know, trying to make this all different. We have Nursology Theory Collective, another group. Thank you to social media. I don't engage too much, but when I find like-minded people that I learn from, I think it's really something that we can connect to, right? So even when we engage with our students and our learners, let them know the folks to follow on social media, right? And broaden their learning to see that nursing is also in social media, that learning is also outside of peer-reviewed journals, right? Human Impact Partners, their strategic plan for 2020 to 2024 is really a wonderful document, as well as this book, Decolonizing Educational Research by Dr. Patel. And here on the bottom right, I have the cover of this wonderful APHA resource, Racism, Science and Tools for the Public Health Professional. Okay, a couple other things I want to point out here as well. How do you welcome students into a learning setting on Zoom? Are you playing music? Are you doing check-ins? Are you doing check-ins where they can be anonymous? Are you doing check-ins where if someone wants to delve deeply into something, you do provide space for them to do that? Are you doing check-ins in your meetings? How are you taking care of each other? Right? Versus just assuming that we're all just gonna make it through our teaching and our scholarship and our learning and our writing, all the Zooms we're scheduling. So I really encourage you to think about how you're fostering and nurturing community in all the spaces you're in. And when you do it collectively, that's where the power is, because it's not all just on one or two people's shoulders. Okay, and so I just wanna prepare to close out and say, you know, nursing is not healing unless we make it so. And so for you, what is healing? As a nurse, what is healing? So I just want to say many, many thanks and salamat.
Thank you, Dr. Claire, and we will welcome questions. If you have a question, please type it in the Q&A and I will elevate that to Dr. Valderma. I have one comment here. Angela is saying thank you. Jess Hall, she's saying thank you. I wish I could erupt in applause. Yeah, you can applause. So we do have a lot of thank yous coming in for Claire, and let me see whether we have questions. There are folks asking about the slides, and that is probably for you to connect with her individually, but this broadcast is gonna be online, maybe after a week or so after our AT department goes through it and we'll post it. And then we do have a question here from Colin Wilson Mitchell, all the way from Canada, and asking whether you're available to speak for a group in Canada. Dr. Claire has put her email address on there. I think that is something that she can respond to. But let me look about at other questions. Yeah, Colleen has put her email address and her phone number there, Dr. Claire. You can check that out because she would like to talk to you about consultancy work or curriculum design.
Sure. You know,
and Eden is asking about a copy of the books you referenced in the picture.
Sure, yeah, I can send out, if you email me, I'll email you back with resources, because they're also.
So from Manishki, one question here, you gave us so much to unpack. I agree. What do you think the number one thing nurse educators should address?
The number one thing, ooh, that's a big question. I guess it's more of a fundamental, broad question of what are the forms of violence that we enact upon each other and our learners? That might be not as concrete as what you're looking for, but there are multiple prongs. And so I invite you to consider that. How do we include? So how do we make it, if possible, how do we make it easy? How do we normalize it? How do we reward it? And how do we require it? So that there are different frameworks for us to consider. But I think part of this is who is like-minded in your group, in your faculty group, where you can engage in ongoing learning while also not waiting for everyone to come to the same place. And you can start enacting ways to address this in policies. So starting with assessment, take a look at your handbooks, take a look at the syllabi. How do you hire folks if you have open searches right now?
Okay, we do have another question from Caroline. She's asking, how is the best way to welcome your students to Zoom?
Oh, yeah, so you know what's interesting is under curriculum, I'm now not only teaching in semester 5, I'm now teaching across semesters 1, 2, 3, 4, and 5. So in semester 5, you know, if it's over Zoom, or semester 1 over Zoom, I literally will take half of the class to ask students, what brings you here? It can be over the chat, it can be through a poll, and it can be through a Padlet. When you provide space for anonymous sharing, as well as, you know, sharing where they're identified, there's power in that. So I think making sure there are different levels of comfort and safety that you provide. Invite students to share stories that they're reading, invite students to share what they're watching on TV, and how can we connect that to nursing or to health. When students realize that they're more than just someone taking courses and filling out assignments and doing care plans, that we care about them as whole human beings and we want to build relationships with them, that's where there's really some power and magic to it.
Mm-hmm. I do have another question, and I encourage everyone to use the Q&A as the place to present your questions. Janet Kaz, how do you teach the racist history of nursing as a profession to include not allowing Black women to be in the ANA, for instance?
Yeah, so the racist history of nursing, you know, to be honest, some of it is us presenting some information and sharing stories, but it's also connecting with filmmakers and other storytellers. So for example, there's a film called I Am Somebody, I believe, I might be misnaming it, but it's all about hundreds of nurses, primarily Black nurses, who went on strike for weeks. So how do we bring in different voices? It doesn't have to be just through us through a PowerPoint. It can also be through someone's memoir. It can be someone writing their own autobiography, right? And so how do we, so for example, when we ask students, why did you choose nursing? A very common answer, you've already heard it, is I want to help people. So something that happens is there's an unlearning that also has to happen, because you know what? Community organizers are helping people. Teachers are helping people. Someone working in recology is helping people. So what is it about nursing? And that asks us, you know, so something else I'll add to a previous question is the first day of seminar in semester 1, I asked students, I put on a slide and I say it has a box that says voyeurism, a box that says solidarity, a box that says charity, and things like that. And I say, what's a common health issue that you're all hearing about or thinking about? And they'll say something. And I say, well, how does our approach to that health topic change if we're coming from a framework of charity or voyeurism or solidarity or accomplish? I mean, you know, there's so many terms that we can use, but making it very clear that power dynamics shape the questions we ask, which means it's our responsibility also to question the ANA, to question all of our professional organizations and demand that their goal is not just gatekeeping and protecting status through certifications and things like that, but also really serving our communities. Because if we're only going to look at protecting a profession, we're not going to protect society. Okay, so those are just some things that come to mind.
Yeah, we do have a question from Christine Stevens. We are trying to do a new RN curriculum which focuses on decolonizing focus. However, we are running into national accreditation standards are not written to support this work. We have tried to work with a national organization. I was wondering, how can we change curriculum as we change accreditation of nursing programs?
I appreciate you sharing that. You know, I'm going to share a graphic from one of my last presentations or publications. This one right here. So on the left is that's focusing on pedagogy. If you're teaching social justice, you're looking at equity, relationism, and action. If you're protecting the status quo, you're looking at these on the bottom. But I invite you to cover the left side of your screen and look at the concentric circles on the right. This is what maps out, you know, and so you can see part of this are accreditation standards. So if we were, you know, one of the questions I asked before is when we shift from a biomedical model to a health equity focus or social justice focus, it means that we're asking about collective action. So imagine if you were to connect with faculty across your university system or college system, or if we were to look regionally, maybe connecting with folks through your regional nursing organization. If we were to work together to craft different accreditation standards, imagine what that work would look like. If it weren't top down, but community, patient, nurse educator, nursing students working up. So part of this, you know, what I would say about nursing education is we would really benefit from having some community organizing skills within our profession. If we were to devise if one of our goals, long-term goals, was to work collectively to demand change to our accreditation standards, that would be something. Mm-hmm.
So we do have many questions, and I'm sure we may never get to all of them, but Angela is asking, do you have any recommendations for supporting BIPOC students in a majority white college and program? We discussed providing additional resources to BIPOC students or students who come from under-resourced high schools. Do you have recommendations for best practices?
I appreciate you asking that question. So something that I'm doing right now, so for my dissertation, I interviewed nurse educators, and I knew that I could never stop there. So right now I'm starting a new research project where I'm interviewing nursing students. And so I'm gonna share some quotes with you that I just keep right here because I remember their voices so clearly. One is, I will not make waves I can't swim in. So what are the avenues that students have to share and to voice their concerns? Whether that's because they were forced to look at a transcultural nursing textbook table where their community was reduced to a stereotype. Or are there, you know, so what are those avenues? And are there avenues for faculty also to identify those textbooks? When students hear from a faculty member statements such as, you know, we really do need a more diverse workforce. But then that same faculty member in an office hour will demonstrate behaviors that are harmful. So let me give you an example. So for example, if a student goes to office hours to better understand their score on an exam, not necessarily to argue for points, but to better understand where the faculty member is coming from. They're mapping their landscape, just like I'm asking us all to do that for ourselves. And the faculty member keeps thinking it's about getting more points, whereas the student is really just trying to understand so that they can succeed. And then it escalates and faculty member holds on to that, you know, oh, it's just trying to get more points. And the student starts raising their voice. If the faculty member backs away and is afraid, what does that communicate? It communicates that your desire to understand that's not what I'm seeing. I think that you're just trying to get more points and you're just trying to swindle me. I'm not going to give away points. I'm not going to compromise my integrity as a faculty member. So what are the power dynamics always at play? Now, where does that student go? Does that student end up going to the only faculty of color in your department? Or maybe the only queer faculty member? So this is directly shaped in terms of the infrastructure of a program and what policies are present. So what are the actual, because it's going to happen, because a given is that our nursing education institutions enact racism and other forms of oppression. So just assume that it's there. Now, where are those students going? Are they going to student leaders? Are they going to another student who identifies as maybe BIPOC at another nursing program? So who are they reaching out to? Every student now that I interview for that project, I ask them, have you ever thought of leaving? Every single student of color has said yes, every single semester. So that, you know, other times, another example I'll give is if there's a student who is trans and wants to bring up trans health issues into a classroom, and the faculty member says, oh, we don't have time for that, or oh, bring that to office hours. So in what ways are we silencing? And so when maybe that's in your faculty affairs committee, how are we silencing? How are we supporting agency and curiosity in our courses? So those are some things that come up, because there is such a range of harm that students are, you know, another student said there's harm at every corner, but I refuse to leave because I don't want them to know that they won. So I would say, and one last thing I'll add is, are you connecting with the Diversity and Inclusion Student Center on your campus, if there is one? Because that is a wonderful place to help build faculty and build relationships for students.
So equity, inclusion versus silencing, give them agency. So we do have another question here. It's a comment, but also a question. I am a current nursing student, and it seems that there is a lot of weight placed in cultural competency, but it seems that all of our material is only covering what feels like very problematic stereotypes, like that chart in your slides. What do you do if you could be a student all over again to help bring awareness about this to the faculty or to other students? It doesn't seem like we have much time for discussion about this topic in my classes. I want my program to feel more elevated and to move away from such reductive ways of teaching about diversity in medicine.
Well, first, I just want to thank you for being here. Please email me. Secondly, there are avenues. I would encourage you to capture snapshots, to, you know, gather the evidence, bring it to the curriculum committee, bring it to the student affairs committee. I know that, in, you know, so for example, there's I believe it's at UCSF, similar issues, and actually out of that was born the Nursing Students of Color organization. And so part of this is the organizing pieces. Who else among, you know, your peers are interested in and ready to move, activated to move? And so I would love for there to become some kind of, you know, what is the role of student nurses associations at the institutional level, state level, and national level? I would love for this to become a priority for students also to demand change to your curriculum. So I really encourage you to bring it to your student affairs committee among the faculty, bring it to your advisor, and then also connect, just, you can email me, we can connect, because there are ways to come together across nursing programs and to say this is change that needs to happen. You're not alone. It's frustrating, but you're not alone. Something that I've started doing with a group of kind of co-conspirators in nursing is putting together a glossary. How can we abolish nursing as it is now in its, you know, the anchor of white supremacy and colonialism? So terms like frequent flyer, terms like cultural competency, it's very outdated and it's harmful, just perfectly how you described it. How can we look at cultural responsiveness? How can we look at celebration, culture as strength? How can we look at cultural humility? And so part of this as well is, how are we asking faculty to look beyond maybe what we learned when we went through school? You know, it goes beyond CEUs to the desire to see that these are harmful. So yeah, those are some things that come to mind. Again, thank you for being here.
So Jean, I would encourage you to contact Dr. Claire for those resources. She's asking about where you find the attrition rate resources. She did find one, but she'd like to compare multiple sources. So she has her email on that screen. Make sure you contact her for those resources. But we do have a few other questions here. Thank you so much. One question I have is that I want to know how you advise students interested in CNA versus other nursing pathways. I have seen many people of color students being encouraged to enter nursing as a CNA. However, this often feels that the recommendation is rooted in assuming academic ability in the students. How have you pushed students into becoming RNs, nursing practitioners, etc., without dismissing the important work of being a CNA?
I appreciate you asking that question. So something that's about my program, the students I interact with, they are all only interested in becoming RNs. I think something that this brings us to a broader topic of what happens when we change the minimum requirements. So because everyone wants to work at a magnet hospital, everyone wants to be the one that's hired, and a BSN carries a particular form of social and economic capital. And so very few students that I work with actually are considering becoming a CNA full-time. Several of them work as a CNA during the program, but their goal is fully to become RNs and then advanced practice nurses. But to be honest, very few want to become nurse educators and very few want to become researchers. So we're very much still geared towards the biomedical model focused in on hospitals for reasons we understand. But I hear what you're saying about the racialized guidance, racialized advising. So I am hearing that because at our institution, there are thousands of pre-nursing students. And so I'm wondering what advisors meeting with those students are saying about, oh, go here instead of here. I have heard from students who are currently in the program that they heard from faculty in other departments, nursing is so hard, you should just not pursue it. And if they were all students of color. And so it's not something that's directly within my purview of the students I'm working with, but I do know that there are many faculty who had that experience where I was told by a guidance counselor, just become this, just become that, that's too hard, or you won't be able to afford that. So again, when we think about who are our partners, who are advisory board members, are we working with advisors and colleagues who are approaching their work in a holistic, anti-racist way? Who are the guidance counselors at high schools that we're maybe connecting with in our pipeline building? And how does racism work itself through our guidance counseling? And so, for example, when I meet with students as an advisor, I want to know what their dreams are. And I want to build relationship. I don't want to just say, this is the specialty that will help make you more money. So I think part of this is holding counselors and advisors accountable, and also making sure that advisors are actually trained to become advisors so that we don't put these extra obstacles in front of students that make it harder to graduate. So that's a roundabout way to touch on that a little bit, but I appreciate your question.
So Caroline has a comment here. Mary Seacrest, a Black Jamaican nurse midwife. She's of mixed race, Scottish, African. Was she mentioned in the year of the nurse and the midwife anywhere?
You know what, I appreciate that question. Oh, our obsession with Florence Nightingale. So actually when I actually saw this on social media, I'm not sure if it was the ANA or maybe an organization in the UK, but they mentioned her, but the phrasing was so problematic. I think a phrase in the description was a Black, something like that. It was really problematic. And so their attempts, and it still is very colorblind. So that's another thing I encourage you all to do is, again, who are the nurses that you uplift? How much is your program, how much of your learning materials, how much of pedagogy is about praising Florence Nightingale in a very colorblind, ahistorical way? You know, and it goes beyond nursing. It's also who are the authors we're asking our children to read about. I just read a book yesterday with my kids about Harriet Tubman as suffragist, as general, as nurse, as granddaughter. So, you know, we can be creative. I encourage you, if you teach pediatrics, bring in a whole bunch of books that are written for children and say, what are the things that we are asking our children to learn about? You know, another maybe thing for us to consider is maybe more of us should be writing, and not only if we have a doctoral degree. who are the, maybe, so how is your institution celebrating the Year of the Nurse? Maybe there's something you can do, or it's a quick blurb about all these different nurses, past, present, and in future. Highlighting profiles. How are we celebrating? Who are we celebrating? So yeah, I really ask you to consider how much Florence Nightingale has a foothold in your program. Thank you for asking that question.
So Brother Ade is asking, what are some best practices to incorporate restorative practices between nursing administration, faculty, and students?
I appreciate that question. You know, something that comes to mind for me is there's also there's restorative justice in practice. There's also transformative. And so, you know, Dr. Monica McLemore comes to mind. Are we trying to retrofit? Are we trying to reform? Or are we reimagining? Are folks waiting for people to retire? Or are folks ready to have the dialogue? So what are the skills that allow for that? One is just a culture of a department where you engage in dialogue, where it's not just about being nice and agreeing just to get things done. But part of this, I would say, is how might you have a cross-section across maybe faculty affairs, across maybe student affairs? Because I would say restorative practices and transformative, it challenged us to cut across the silos of student, faculty, staff, and administrator, or chair, or dean. And to engage in that ongoing learning. So one great practice would be intergroup dialogue facilitation. I know there have been amazing sessions focused just on that at NCORE in the past. I wish I could have gone to them. But how do we get into the practice of facilitating dialogue? Because when we learn how to teach nursing, you know, from my experience and from what I've heard from participants in my studies, is we don't learn how to facilitate dialogue, which means maybe we are ourselves not practiced in dialogue. And so some of it is a skill, some of it is a study. How can we engage in learning about restorative or transformative practices in justice? We might need to look at other departments. I know that there are, one of the speakers at a previous NCORE, she had just graduated from a social work degree in the Midwest. And so I'm wondering, you know, who are the programs that are already doing it? And if they're not nursing, that's perfect. We can learn how to adapt it to nursing. Who are the grassroots community organizers with the skills around facilitating this? So there are organizations, and there's one scholar who comes to mind, I think Mia Mingus comes to mind. She facilitates trainings focused on transformative justice. And so I think the knowledge, the skill, the theory, and the practice, having regular practice, those are some things that come to mind for me with that question.
Mm-hmm. I want to read a comment from our chat here from, I think it's Jai Iverson. Thank you for encouraging us to open our minds as nurses. We can do so much good for what is occurring in society right now. I have felt so alone in my thoughts as I watch my colleagues over 30 years bring their stereotypes and injustice to patients we are committed to helping. Many of these patients with the issues you have addressed today. So refreshing to see what I hope to be a new revolution in nursing, a culture of strength, humility. So well said. But I also want to point out that Karina is saying she has brought her undergraduate pre-nursing students with her. Thank you so much, Karina, for bringing your students. If you had one piece of advice for them as they start their educational journey, what would that be?
Oh, thank you so much for bringing your students, your learners. Welcome. We're so glad you're here. I think one piece would be, maybe two, but the first one I'll mention is, you are not entering a profession, you are embodying it, which means you will advance it. And so we need you. Please bring your whole selves as much as you can and hold each other. Something that I see that sometimes happens is the level of competition that comes from, you know, neoliberal approaches to learning. It leads to students rolling their eyes at each other when someone brings up a topic such as racism or a topic such as transphobia, and then they roll their eyes, and then a student learns that their cohort doesn't have their back. So please hold each other, care for each other. We need you. And I ask you to practice the skills, to let your faculty know, to hold them accountable. When you see problematic materials, please, develop that email in your back pocket of how, I'm concerned about this. I noticed this in the readings. Can we engage in dialogue to talk about the implications of this reading or this course material? So part of it's going to be you all coming together to flex your muscles when you see problematic things happen. But again, thank you. You're going to embody the profession. You're not just entering it. So thank you.
Mm-hmm. I do have another question here from Kim. It's really timely because personally, I also know a lot of nurses who are African. I have, I think, 3 sisters who are immigrated here, and they are all nurses. This is what she's asking. Does your curriculum address nuances in your teaching that immigrants may not understand? For example, an African student who comes to US to study nursing compared to an African-American nursing student who has lived with the legacy of slavery.
Oh, I appreciate that. Something that I think, so I'll speak from my teaching practices. Something that I've learned to do more and more in real time, in Zoom or in person, is being explicit about my positionality, just like at the beginning of this. So I will say, well, when you ask that question, I lean towards this, and that's because of being a daughter of immigrants, or that's because of my experience, working with, this population. And so when I ask students, to consider learning materials, a lot of the work I assign in terms of assignments has reflection at its core, right? So for example, I'll ask students, from these 5 articles or these 2 videos, please select 2 articles, select 1 video. Now, how does this relate to you as a person? As a whole person? And then how does this relate to you? What comes up for you as a nursing student? And then number 3, how does this relate to your career goals or how you envision yourself as a nurse in the future? So much of the work that I ask students to do is reflection-based. And I ask them to get practice in identifying their own positionality and then we can share and bring it together. And sometimes I do that using a Padlet. So a Padlet where I'll put certain prompts and then students will see what everyone else answers, and it adds to the richness of the learning. So all forms of context. So for example, just because a student might be an immigrant or a child of an immigrant doesn't mean that there aren't ideas that are very xenophobic, right? So there are all the nuances. So just providing students with the space to share their positionality and their reflection. And something else I'll add to that is something I've started doing maybe just a couple of years ago, is a required portion of most assignments is that students ask follow-up questions so that they can know that the learning has to keep going. But yeah, I think positionality, so again, when I asked earlier, what are the counter narratives? What are the voices and stories that you're bringing into your classroom? It has to account for that as well. Different migration stories. So yeah, thank you for asking that.
So we do have time for a couple of more questions, but I also want to address, and I want to ask our NCORE staff to respond to this, maybe to the attendee or on the chat. How do I save the full transcript? So Kathy, if you're still there, please respond to that attendee. I think the transcript is going to be available when this video is available, but I think also that you can save your chat. There is a way to do that. But I'm gonna go to Caroline Abiazim. Thank you so much. How do you advise faculty of color who feel that their opinions are not taken seriously, even when it is to benefit the students and the program in general? Oh, she had asked me to read without her name. I'm sorry that you wrote that at the end. So how do you advise faculty of color who feel that their opinions are not taken seriously?
Well, my first thing that comes to mind and heart is I hear that. Something that's interesting is with all my scholarship, oftentimes the first response from colleagues who even want to, who listen to it to certain degrees is, you're really not coworkers right now, but colleagues in nursing education. The first answer is, you're so passionate. And I just thought, did you really just reduce scholarship to passion? There's so much more there. But absolutely that happens. That happens more frequently than we. So if there's anyone here who has more capital in your department, that's a reflective question for you all that I invite you to consider, is how are colleagues in your departments surviving you? And how are colleagues in your department maybe, and actually students as well. I'm starting to hear in my interviews with students that students have also been more prone to giving faculty of color a harder time. So I would really encourage you to, part of it is the mapping. Who are the allies on your campus that you can connect with? So for me, I've heard things such as, well, Claire, this isn't a social justice course, this is nursing. And so my allies, my comrades in this have become nurse educators I've met through Twitter, who are teaching in all different states, who I continue to learn from. But I also have colleagues in the University Diversity Office, folks in advising, staff. And so who are the folks who will help you feel whole? And then also, who are the folks in your area who you can strategize with? And what are the actual gatekeeping mechanisms? So, for example, I've worked with faculty who wanted to bring their students to the Museum of Tolerance to address the role of oppression in health. And faculty told them, you shouldn't do that, that's not really nursing. But faculty who say that, there's also academic, autonomy, academic freedom. And so I'm wondering how much of it is what's possible versus what might make us uncomfortable to assert and just do without asking for permission. And I say that as something I also still grapple with. But for a more nuanced answer, please email me. I'd be happy to connect with you, because I know when it feels isolating and there's hopelessness, it can be just a whirlpool of hopelessness. So I encourage you to connect, and we can talk more about that.
So we are joined by many folks here who advise nursing students or students who want to be nurses. So what advice would you give staff, academic advisors working in pre-nursing with pre-nursing students? They are not yet admitted to upper division licensure curriculum.
I appreciate that. Thank you all for being here. So something that's interesting is there's a slow delayed movement across nursing to have more holistic admissions, similar to med schools. And so that's part of the game. So I would say for nurse educators, we need to change these admissions policies and change the accreditation standards. For advisors, I would really invite you to take a look at, what are the criteria where students get more points. I know that might be too. So, I mean, that's one thing. Another thing is, if you have the time, really ask students, what is it about nursing that is drawing you to nursing? Because I will tell you, I'm also doing a study right now where I'm interviewing Filipinx health workers, and a lot of it is pressure from family for different reasons. So I invite that advising relationship to be one of self-actualization. Of what is it about nursing? What makes you feel like this is the fit? And then taking a look at all the criteria for points, whether it's speaking different languages, GPA, things like that. But I really encourage you to do, even a critical race theory focused review of the questions that you tend to ask students. And there might be some students who you might be the third or fourth or fifth person who has told them they're not capable, and you're the first one telling them that you're capable. What does that mean? What is the significance of you telling them they're capable? So those are some things that come to mind. But part of your work is also our work as faculty to do a better job about our admission standards and criteria.
So this is very, very encouraging, and we have had so many questions. But I want to ask one last question from Janet Kaz. I think this is critical for us to ask. She says that she recently completed pilot testing, a cultural competency tool that rates this from the patient or client perspective. Their perspective of the provider's cultural competency piloted with Native Hawaiian and Philippine community. We define competency in terms of sensitivity and empowerment, and it comes from transcultural nursing research. Do you really consider cultural competency as an idea wrong?
So I would say my primary issue with cultural competency is that an understanding or underlying assumption is that you can gain mastery level. And so I would say that that can really end up supporting the reduction. Now, if we had a more nuanced definition of culture that didn't conflate it with race, I might, I'd be curious to hear more. But the idea is that we can't and will not ever know everything. And so how do we shape that dynamic as one that is centered upon knowing that it matters and not reducing someone to labels, but that we're humble in the process of learning, that we know that we're not going to know. So even if I were to work with 100 Filipino students who are also children of immigrants, grew up middle class, also identify as women, I'm still not going to know everything, and the level of assumption can be really problematic. So how do we shift it to humility, but also one where we see that culture is here, and also there's structural issues as well. So I really recommend, if you haven't already, Dr. Denise Drevdahl's article that focuses on shifting from a focus on culture to structure. And so, for example, Robert Wood Johnson Foundation has those Culture of Health prize winners. And I ask students, what are the cultural components, and then what are the structural components? If we always focus only on culture, we're going to lose the context of those living conditions and relevant policies. So it's a dynamic, but there's great research, including that one from Dr. Drevdahl that I recommend you read if you haven't already. Thank you for that question.
Well, we have reached to the end of our broadcast, and I want to thank our Dr. Claire Valderrama Wallace. This was wonderful. I hope that you all learned a lot. Thank you so much for joining us. Again, her email address is on the screen. So if you have any specific questions, please direct them to Dr. Claire. This broadcast is going to be available probably 7 to 10 days from now, and it's going to be available to every registered participant. We thank you for joining the National Conference on Race and Ethnicity in Higher Education from the University of Oklahoma in Norman. Thank you so very much. If you have any ideas of webinars, you can contact us. We can work with you, and we look forward to continuing to learn. Thank you so very much, everybody. Thank you for joining us.